Have you ever heard about chemical pregnancy? What is it all about? Is it when chemicals are used to get pregnant or something else? What have you heard about it? Do you have any idea about it? Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be talking about chemical pregnancy. What are the causes of chemical pregnancy, how to prevent chemical pregnancy, and also if there's a treatment for chemical pregnancy. But before I go into details in today's class, if you are new on our YouTube channel, please click on the subscribe button, turn on the notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, today we're going to be talking about chemical pregnancy. Chemical pregnancy. The definition is going to be shocking to you. And one thing about chemical pregnancy is that some people have had chemical pregnancy, but they never knew they had chemical pregnancy because they were seeing their period. They saw their period, so they didn't even do tests. They didn't find out what and what is wrong. So let's go to the details proper. In simple terms, chemical pregnancy is a very early miscarriage. It's a very early miscarriage. The baby is lost before it gets to 5 weeks gestation. The baby is lost before it gets to 3 weeks post-fertilization. If it is lost before it gets to 3 weeks post-fertilization or 5 weeks of gestation. So the baby does not even get to 5 weeks. So you to say, okay, I'm 5 weeks pregnant, I'm 6 weeks pregnant. So the baby is lost. So you may do a pregnancy test and it shows positive, that's you are pregnant. But after then you see your period. After the positive pregnancy test, you see your period. So that should give you a clue. That is how it's been diagnosed generally. For those asking how is chemical pregnancy being diagnosed. Chemical pregnancy is being diagnosed when a lady did a pregnancy test. She found out that she was positive, and after some days, she sees her message, she sees her period, and she's like, oh my God, why is this period out? I'm pregnant. It's just positive, but I'm seeing my period. That could be a sign that you have had a chemical pregnancy. In chemical pregnancy, there's a positive pregnancy test, but there is no baby. This is because the baby goes away soon after it's been formed. After the fertilized egg is being formed, the baby goes away, the baby dies or something. The baby is no longer there. That's what results in chemical pregnancy. You do a scan, you don't even see a sac, you don't see anything in the scan, it's just blank. That is what happens in chemical pregnancy. So for those that have done pregnancy tests, it's positive and they end up seeing their period, that could be a chemical pregnancy. So then that takes us to the signs and symptoms of chemical pregnancy. For the signs and symptoms of chemical pregnancy after it has happened, the first thing you see is maybe heavier than normal period. For example, you were using 2-3 pads a day, but when there's a chemical pregnancy, there's a possibility of using 4 pads, 5 pads, even 6 pads a day. So there's heavier than normal period when it comes to chemical pregnancy. Then the second is you could see blood clots. That's blood clots. I'm going to drop a picture of what a blood clot looks like. You could see a blood clot on your pad. That could be, there was a chemical pregnancy. And also, for those that were not having menstrual cramp before, you were not having menstrual cramp, you just see your menses normally, you start having menstrual cramp. That could be a sign of chemical pregnancy. And also, there is no pregnancy symptoms. There's no breast tenderness, there's no nausea, there is no vomiting, despite having a positive pregnancy test. So these are the signs that should give you a clue that you have had there's a possibility it might be chemical pregnancy. Then the next question is, what is the causes of chemical pregnancy? The cause of chemical pregnancy is not known. Mostly it's not known. But there are some factors that says that it could be as a result of chromosomal abnormality. There's something wrong in the chromosomes. It could be in the egg, it could be in the sperm, it could be in both the egg or the sperm. Then the second is for those having low body weight, they are at higher chances that, let's put it that way, they are more likely to go have this chemical pregnancy than those having normal body weight. And the other one I have here is lack of proper implantation. The egg did not implant properly in the uterus. The egg did not attach itself properly in the uterus. That can result in chemical pregnancy. The first is chromosomal abnormality. The second is low body weight. Then the third is improper implantation or attachment of the fertilized egg to the uterus or the uterine wall. Then for those asking, what is a treatment for chemical pregnancy? There is no treatment that I know of for chemical pregnancy. There is no treatment for chemical pregnancy. Another question came, does chemical pregnancy affect fertility? Chemical pregnancy does not determine your fertility. It does not affect your fertility. So for those that say, oh, I've had chemical pregnancy before, is there a possibility I'm going to have chemical pregnancy every time? No, it doesn't affect your fertility. So you can have chemical pregnancy this month and next month you are pregnant. The real pregnancy, not chemical pregnancy again. So chemical pregnancy does not affect your fertility. Then now you are asking me, how can I prevent chemical pregnancy? In terms of prevention of chemical pregnancy, there is nothing you can do. It's not within your power. It's not your fault that you're having chemical pregnancy. But there are some things you should take note of, especially when you are trying to get pregnant. You're expected to take your prenatal vitamins. Your prenatal vitamins that contains folic acid, which helps with the brain and the spinal cord formation for it to form properly. So you can take your prenatal vitamins and also your lifestyle, stop drinking, stop smoking, and stop doing those things. That can help you prevent such. Then also some people are at risk of there are some people that are at risk of getting chemical pregnancy. For example, women that have had a polycystic ovary syndrome, which is an hormonal imbalance and hormonal imbalance problem. Polycystic ovary syndrome, people having a history of diabetes, people having history of thyroid diseases, that can predispose one to get chemical pregnancy. I'm not saying when you have this you are going to get chemical pregnancy. I'm just saying it might likely increase your chances of getting it. So this is just an educational video. It's not a diagnosis per se. So when you notice any abnormality or something strange happening to your body, it is better for you to consult your doctor as soon as possible rather than assume nothing is wrong. Please and please always consult your doctor when it comes to your reproductive health and your health in general. So this is what I have to share with you about chemical pregnancy. In chemical pregnancy, there's a positive pregnancy test, but there is no baby. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video. I love you.